This is the Aftermarket Radio Network. Hey, everybody. Welcome. Carm Capriotto, Remarkable Results Radio, and another Town Hall Academy celebrating Breaks for Breasts. This is all about fueling the fight against breast cancer. We have been a champion of Breaks for Breasts for years. You will always hear one or two episodes a year about this. And we are here to tell you the story of 2024 and the check presentation and how much money we have, or they have so far raised. Huge amount. It's all due to the fact that the automotive service repair industry has gotten behind this great initiative to work very, very hard to find a cure or a vaccine for breast cancer. We appreciate our great sponsors. Hey, for over 30 years, NAPA Trax has made selecting the right shop management system easy by offering the best, most comprehensive SMS in the industry. We'll prove to you that Trax is the single best shop management system in the business. Find NAPA Trax on the web at napatracs.com. Hey, how well does your team know their stuff? Test their automotive skills with the Today's Class Basic, Advanced, or Service Advisor quizzes. It's a quick, effective way to spot gaps and grow stronger teams. Take the quizzes now at todaysclass.com/TC quiz. All right, now let's get started. Hey, gang, welcome to our Summertime Breaks for Breast discussion. I'm with Leanne Best, one of the founders of Breaks for Breasts from Mighty Auto Pro. Hi, Leanne.
Hey, Carm. Hi, Justin and Laura. Good to see everybody. Carm, thank you so much for helping us again get the word out about Breaks for Breasts.
Thanks. Thank you, Leanne. Laura Frank is here. Laura, last year I talked about you being in the shop business and you're coaching, right?
100% coaching. We were able to sell our repair shop. We were doing that for over 30 years, so it was time. We're getting up there in age, starting to wind down a little bit, but we love our coaching and our training for service advisors and shops. And yeah, so it's been a lot of fun.
Glad you were able to make that huge leap. I know there's so many people out there ready to find that joyous retirement opportunity.
Yes.
Justin Johnson, PhD. Hello, sir. Welcome.
Thank you, Carm. It's nice to be here today.
Always great to have someone smarter than me on the show all the time. It's great. And all the great work you're doing at Cleveland Clinic. I have personally been to your lab. I'm like a kid in a candy store when it comes to see how stuff works in technology. And you have a hell of a team. You've worked very hard over all these great years. You'll hear some of that great story. Look at everyone. The number reached 2 million this year. Let's talk about that. Let's put up a number. There's the number.
First, we have to definitely thank this incredible industry. I don't even have words to see that we hit that $2 million mark. I mean, we hit 1 million a couple years back, and then all of a sudden, 2 million. We have an incredible independent auto repair industry. Without any of you guys, it would not be possible.
Boy, that's the truth. I just remember year one when we raised $10,000 and we're pinching ourselves. We're like, oh my gosh, $10,000. And now it seems unreal. It really does. This incredible industry that we're a part of. We are so blessed.
I love to hear the story of the origins of this. I love it. It is the coolest story in the world, how all of this connected. Why don't you share that story?
You know, gosh, Laura and I were just sitting at dinner one night talking about what we could do, because Laura always says, as a shop owner, you have visibility, and with visibility comes responsibility to make the world a better place. So that night, over chicken wings, we developed Breaks for Breasts. That was September. We thought, wow, October is the perfect month to kick it off. You know, let's just get started. Let's just take action and see what happens. We had two specifics in mind. Number one, every single penny we raised had to go directly to the source. No office buildings, no marketing budgets. So we literally operate on a budget of zero. And then the second big ask we had was that whoever we selected to be the recipient of our fundraising had to align with our goals. It had to feel right. Honestly, that was not a small undertaking. That took some effort. We talked to all of the big guys out there that you would normally think of in the breast cancer area. And none of them they were like, well, here's a 17-page contract and you have to write a check to give us money. And I was lamenting about this very thing at a BNI meeting one morning about how hard it was to find who we felt was going to be a good fit for us. And lo and behold, the woman I was speaking with went back to her office that day and she was sharing the story with another coworker. Before I know it, my phone's ringing and there is this woman on the other end of the phone that is like, wait, I heard what you're doing. Don't do anything else. Don't talk to anybody else. We have to talk. You have to talk to Dr. Vincent Tuohy. Well, lo and behold, it was Justin Johnson's mom, and never underestimate the power of a mama. So she's like, before you talk to anybody else, you're going to talk to Dr. Tuohy. And honest to goodness, we met Dr. Tuohy and it was pretty much love at first sight. I mean, prevention is the cure. He aligned perfectly with our vision and he was perfectly happy to accept our fundraising effort. So it has been an amazing, incredible ride ever since then.
I love that story. Every time I hear it, I get this really big smile. And there's Justin sitting here on our screen, who's the lead researcher. We lost Dr. Tuohy a few years back.
Dr. Tuohy, anybody who met him would know he was a big personality. He was a big dreamer. He had these seemingly impossible goals of a small lab at Cleveland Clinic, launching a phase 1 breast cancer vaccine clinical trial, soon to be phase 2, and with no funding to do it. And wow. And yeah, the fact that my mom was the link that brought us together with Breaks for Breasts, we really have to get my mom on one of these podcasts, I think.
We do.
Oh my goodness, that would be awesome, Justin.
Yeah.
I love that idea. So you had the idea of wanting to do this, Leanne, Laura. Was there anything personal that drove this?
Yeah. For me, my mother was diagnosed with ovarian cancer. And ovarian cancer is related to breast cancer via the BRCA1 gene, which now I've come to find also pancreatic cancer is genetically tied to that BRCA1 gene. But when somebody you love is diagnosed, and unfortunately, there's a lot of people out there that get it. You're not the doctor. You can't design the protocol. And so at least I did, I felt helpless. And I wanted to do something to make a difference and to help. And so Breaks for Breasts was formed.
We're giving the industry this update to talk about the 2 mil, talk about everyone's effort, to talk about where we stand as the vaccine continues to rise in prominence in the different phases. And some of the news stories that are being done on this specific initiative, we're asking for the industry to step up. I mean, we could quadruple the number of people and hit a 3 million mark in the shortest possible time if you would look at this as a independent shop owner and say, it's time I get involved. Guarantee, and this is a bad stat, Justin, you could help me with this. A percentage of our customers have been affected in some form of having breast cancer in family and in friends. A lot of people survive. Some of them don't. But it's close to all of us. My wife, Ann, had it. And so when you talk to people about what this initiative in October is going to be about, well, October, I do some other things in the community. Great. Well, why don't we do something all year long? It doesn't have to necessarily be how Breaks for Breast is designed for October. It could be an ongoing initiative. I wonder sometimes, Leanne and Laura, why we don't have, thousands of shops involved. We have hundreds, but not thousands yet. And it's 11th, 12th year. And so I'm here on a soapbox trying to, if you're listening to me and you have a friend who says, we got to get involved. We have to get involved. I have to get involved. And that's a simple thing.
I think sometimes people might think, well, the research is at the Cleveland Clinic, or, I haven't really been touched with breast cancer specifically. In the beginning, we used to say, who knows where the polio vaccine came from? We just know that it stopped polio, right? In my opinion, and I'm not a scientist, I think that this research is bigger than just breast cancer. I think that it's starting to change the way we look at cancer. So even though maybe breast cancer specifically hasn't been part of your life, chances are other cancers have. And so this is bigger than just breast cancer. It's bigger than just the Cleveland Clinic. I mean, I feel, in my opinion, this is changing the way we look at cancer in general, treating it. So
You're
get
absolutely
on
Right,
board.
for sure.
Yeah.
Yeah, you're right.
Yep.
And, not only have we been able to continue Dr. Tuohy's program with the breast cancer vaccine, thanks mostly to the generosity of the Breaks for Breast program, we've actually expanded it. So we are now applying the same technology that led to the breast cancer vaccine to an ovarian cancer vaccine, which we're hoping to also get to a phase 1 clinical trial. And we're looking into developing additional vaccines for prostate cancer, lung, and colon cancer. If you can name one person who hasn't been affected in some way by one of those 5 cancers, I don't know any. So, like I said, Dr. Tuohy was a dreamer, and he dreamed big, and he wanted this to be big. And we're following in the footsteps of a really brilliant scientist in taking this to the next step. But for right now, we're focused on getting the breast cancer vaccine through clinical trials.
I love to hear these stories, and I love to talk directly to our industry about getting involved. I remember meeting Dr. Tuohy a bunch of years back, and to your point, I mean, there's a guy, you just loved him. He bubbled with personality, and to your point, Justin, he was a smart guy. And I know that you're continuing his legacy there. You just mentioned 4 other potential, again, I don't know, studies or potential vaccines, or at least maybe the discovery of what you've done with the breast cancer vaccine has opened up research. And that damn computer you guys got over there, are you using it?
Yeah, we are planning to use it. Actually, the computations we're doing now don't require that much computing power, but we will eventually use it.
Cool computer. I was there. I was right next to it a couple of years ago. We missed the check presentation this past year. Listen, if you're not with us on YouTube video, you can watch this. Just go to our show notes page or our YouTube channel, Carm Capriato YouTube channel. But here is the discussion you guys had. Justin, walk us through this.
Yeah, so you can see in that first pink box, we're in phase 1 clinical trials. And what that means is it's a small number of women. Currently, we're at 35 women who have been immunized with the vaccine. And the purpose of a phase 1 trial is to establish the safety of the vaccine, first and foremost, because this vaccine had never been in a human being before. We tested it in the lab very thoroughly, but until it goes into a human being, you don't know what's going to happen. So we start with a very, very low dose, and we slowly escalate that dose as we see that it's safe in several women. And so what we're trying to do is find the ideal dose in a phase 1. We establish that it's safe. We start to escalate it, and we find how high up can we go in that dose where it's still safe and there's no adverse reactions that we're concerned about. And then we look at how the vaccine is working in the body. Now, in a phase 1, we're not looking to determine if the vaccine is preventing cancer. That's something that we will do in phase 2 and phase 3. But what we want to do now in phase 1 is look at the immune response. So these women get a blood draw 4 times throughout the study before they get the vaccine, and then after they get each of the 3 doses of the vaccine. And we look at how their white blood cells are responding to the vaccine. And we have laboratory tests that we do to show this. And the great news is that about 3/4 of the women that have been immunized with the vaccine have shown a strong immune response to the target in the vaccine. So that doesn't necessarily mean that they're protected from cancer. We haven't shown that yet, but it's very, very, very encouraging to see. And it's a much higher number than we expected.
Wow, amazing. Phase 2 is a larger group?
Yeah, so phase 2, which we're gearing up to do, will actually, where we're looking to see if the vaccine is effective. So in phase 1, all of the women are getting the vaccine. In phase 2, women will be randomized into 2 groups, ones that just get standard treatment for their cancer and ones that get standard treatment plus the vaccine. And then, of course, again, we're going to look at safety, but we also want to see if the women that get the vaccine do better than the women who don't.
I got to make a comment on this behind the scenes information. I believe our listener, our automotive industry is learning something right now. They're learning something. Oh, it's technical, it's medical. No, you're learning something you can share with your friends and your family and your people, and maybe, just maybe, stop to realize that one day you were part of something that has allowed the medical community to deliver something this big and this powerful. I mean, there's a lot of energy. We've seen news stories on a national basis on what's going on in Cleveland. Learn something new, talk about it, share it, get involved, breaksforbreast.com. Phase 3 is just another bigger thing, Justin?
Yeah, exactly. So in phase 1, we recruited 35 women. Today is actually a really big day for us because you may have heard that in May, we reached our goal of how many women we wanted to get into the trial, and we had to close our doors.
Oh, wow.
Yeah, but don't worry if you still want to get in the trial. You can't get into phase 1 anymore, but when we open phase 2, we'll certainly share the information for the women that are interested in getting into it. And men as well, actually, can get into the trial because men do get breast cancer. It's much more rare, but our trial is open to men as well. So today, we actually are collecting the very last blood sample from our very last patient that we recruited. And we're going to do the immunologic testing on the rest of the women in the trial. And by the end of September, we will be done and on to phase 2.
Wow.
Crazy.
Wow, it's amazing.
It's my understanding, though, that coming to human trials is a really, really, really big deal.
It is. And as you well know, it took us, well over a decade to get there. And we opened the trial to recruitment with our very first patient in the fall of 2021. In the fall of 2024, we're wrapping it up. And then on to phase 2. We're in the planning and preparation phase. We don't have a trial opening date yet, but hopefully by the end of next year, we'll be recruiting. And we're talking about expanding to about 200 or 300 women in that trial.
Oh my.
And not just at Cleveland Clinic, because right now it's just at one site, but we'll be opening it up to sites across the country so that we have better access to the trial. And as I said, some of the women will get the vaccine, some won't, and we'll really see if the vaccine's working. If everything looks good in phase 2, we go to phase 3. That's just a bigger version of phase 2. And if everything looks good there, then we're talking about potentially bringing it out into the market for use in the doctor's office.
Hey, let's face it. Your shop management system is the single most important tool in your shop, period. NAPA Trax has made selecting the right shop management system easy by offering the industry's best, most comprehensive SMS. Now, it all starts when a local representative meets with you to learn about your business and how you need to run it. After all, it's your shop, so it's your choice, and having local representation is a huge plus. Customizing Trax to your business, whether you're a one-person shop or a large multi-bay or multi-location company, a representative consults with you to help optimize your shop's workflow, efficiency, and profitability. Trax always has the flexibility to do business how you need to do it, which means it can also grow as your business grows. And unlike the other guys, will be there for you after installation with the best training and support in the business. Yes, a learning management system tailored to each role in your company. Simply put, Trax was designed and built for shop owners just like you. Visit us on the web at NAPA Trax, that's NAPATRACS.com. Transform your team with today's class, where automotive training is easy, quick, and fun. Just 5 minutes a day on our app can eliminate hours of looking up forgotten information later. It's perfect for technicians, advisors, and managers alike. Keep critical knowledge fresh and top of mind, ensuring your team operates at peak efficiency. Today's class is impactful, accessible from anywhere, and a bit of fun too, and we're not talking about after-hours pizza either. For training that gets results, turn to todaysclass.com. It's amazing to think that this glimmer of an idea of what maybe 11, 12 years ago is actually now taking shape. And for us non-medical people to stop to realize what it takes to do something like this.
It takes a lot. And if you're a big pharmaceutical company, it's a challenge. But for a small research lab in Cleveland, we obviously could not have done it without the support of Breaks for Breasts. That has really, carried us through phase 1 and into phase 2. To follow up on something Laura said before, some of the audience may say, well, why do we need to raise money for, a trial that's going on at Cleveland Clinic? Isn't Cleveland Clinic doing okay? I think a good analogy here is that while it is being done at Cleveland Clinic, it's being done by our research lab, the former laboratory of Dr. Vincent Tuohy. And the way research works in an academic institution like at Cleveland Clinic is that every laboratory out of the hundreds and hundreds that are in the building is operating like an independent business, like an auto repair shop that has its own bottom line and needs to come up with its own funding and hire its people. So we're working within the framework of Cleveland Clinic, but we're really just a small business, just like the small businesses that are coming together and raising money for our cause.
Just to tag on to that, 100% of every dollar, of every penny raised goes directly to support that lab. So we make sure that goes right there.
When you watch a commercial on TV for a fundraising foundation, you ask yourself, how did they pay for that commercial? It wasn't for free. And so how Breaks for Breast is doing this, I'm sure there's a lot of other money that you're getting, Justin, but in this particular case, 100% of the money is going there. I know one shop in particular, $12,000 was their contribution this year to let's actually show the check presentation for this particular year. How much dollars was 2024? $272,920. And this is the check presentation in 2025.
Yeah. And that does go a very long way in research when every penny is going directly to research. There's a lot of great big fundraising organizations out there that do great work, but they can't do it for free. There are salaries to pay for executives and buildings and advertising. That eats away at the donations. But because we are, already within the Cleveland Clinic and the Cleveland Clinic is supporting our infrastructure, we don't have to advertise. So all of this money, 100% of it goes right into the fund that we use to do the research. And I know that for a fact because, I see this fund and this is where we order supplies from and pay our vendors. You just can't be more effective than 100% of the donations going directly to the cause.
I am so glad in this episode we're diving a little deeper. I mean, we've been trying to recruit every year and getting people more involved, but this behind the scenes, how does it work? How do you fund it? 100% goes, the clinical trials. I think there's some substance in this, and hopefully the objective is to double or triple the amount of players that we have in the industry. We have in the hundreds and we need in the thousands. And when I look at the people that I know in this industry that are so involved and each of their shops are contributing, here's some pictures of us with other people, my daughter Tracy, myself. But, I can go down the list of all these great people that we happen to know in the industry that are doing just some incredible things. So we appreciate individually everybody, what's going on with everyone. What I'd like to do is to move into showing this whole video that was done on your first clinical trial. Am I right? It was first clinical trial from Jen Davis?
She was the first patient and, I would say the most brave because she was the first human being to ever get the vaccine injected into her body. She was taking a risk and she was very brave to take that risk.
So, Leanne, the story is that Jennifer did have breast cancer, was in remission, and she decided to get into the trial?
That's correct.
Yeah, we had the privilege of meeting her too. So she's a beautiful woman.
Certainly was.
Let's play the video, of course.
October may be the month that the leaves start changing colors, but it's also the month we see a lot of pink for Breast Cancer Awareness Month.
Right, a very important month at that. And tonight, senior health correspondent Monica Robbins updates us on the first recipient of the breast cancer vaccine and the women dedicated to keeping her legacy moving forward by putting the brakes on breast cancer.
At 41, Jennifer Davis began fighting the deadliest type of breast cancer, triple negative. The married mother of 3 and nurse went through a double mastectomy, chemotherapy, and radiation. but knew the risk of her cancer returning.
Every time I woke up and, I slept on my arm wrong, I automatically thought it came back.
Jenny said she felt motivated to be part of something that would help put her mind at ease. Her chance came in the fall of 2021 when she became the very first recipient of the experimental breast cancer vaccine at Cleveland Clinic. 10 years before Jenny's first dose, auto shop owners Leanne Best and Laura Frank started Breaks for Breast to fund the breast cancer vaccine research, an October campaign that provided free brake pads for customers, with 10% of the bill for labor and any other additional costs going to the fund. It spread to hundreds of shops across the country.
Oh my goodness, since 2011, those little 10s and 20s have added up to a little over $1.8 million. And we definitely, I think we will, without doubt, cross the $2 million mark this year.
The check presentations were gratifying, but 2 years ago, they were beyond thrilled to finally meet.
She was the person that we were working for all these years to have this person be real. I don't even know that I thought I would live to see the real person.
It was a natural connection. It was like we had been friends forever.
As the first recipient, Jenny received the lowest dose of vaccine. Her participation measured safety, dosage, and immune response.
The vaccine has now taught my body to recognize cancer cells.
While she knew the risks, the results gave her hope. Then on January 31st, she left me this voicemail.
Hi, Monica. This is Jenny Davis. I had spoke to you a while back about the trial. If you could please give me a call back.
And I get a call from Jenny. And she just said, Leanne, it's back. The cancer is back.
While devastated, Jenny also had an important message for her friends.
Do not let this stop your efforts. There's so many women out there that we need to save.
Jennifer Davis passed on April 13th. Breaks for Breast presented more than $200,000 to the Vaccine Research Fund on the day she was laid to rest.
And we'll get there. It's going to take a little bit of time, but eventually we're going to wipe this thing out.
Monica Robbins, 3 News.
This is the thing that so often is overlooked, I think, when it comes to vaccines and this life-saving advancement in care are the people who tried it. Mm-hmm. And it may not have worked the way that they initially thought it was going to, but it gives those researchers this chance to retool and look into things a little bit differently. And maybe they try something else and then it's the next life that is saved. So it's not in vain in any way, shape,
Not
or form.
at all, no.
It's not a failure. It's a success because it didn't come back for a while. And just what an incredible woman.
The knowledge that was gained from the trial and the experiment will, as you said, will not only help the next batch in their trial, but future generations of women to come. And without these early pioneers, they don't have what will end up being generation 2 and generation 3 of a vaccine that eventually will get this thing knocked out. Incredible.
Just amazing. So mad respect.
Thank you so much for getting us that video. We did an episode with Jen.
Yeah, she is really missed. She was just an amazing, brave woman. And in this trial, we go through great lengths to protect patient privacy. The researchers don't know who these patients are. They're just coded by numbers. But if a patient like Jenny decides that they want to go public, they can. And Jenny decided to go public and share her story. And it inspired a lot of people. It really helped us to reach our goal of recruitment. And, even though the vaccine sadly didn't prevent her cancer from coming back, we're hoping that it did at least give her more time before it came back. And we're going to learn a lot from having her in the trial. The good news is that most of the women that have been enrolled have not had a recurrence. We've only had a few, and unfortunately, Jenny was one of them. And we're going to work really hard to find out why. In 25% of the women or so, they don't get an immune response, or in some of the women, the vaccine may not be effective. And I'm glad that we shared this story also because there's been a lot of misinformation in the media and misquotes and bad reporting that is kind of trying to sell the vaccine as this miracle cure that's going to cure all breast cancer and prevent all breast cancer. And in some cases, they'll misquote and say, this vaccine is going to eliminate cancer. We're not trying to say that. We're trying to say that this vaccine will hopefully prevent cancer in a lot of women, but it's not going to work for everyone, and it's not going to work for every type of cancer. So it's always good to get that message out there too. But the big message is that we think that this vaccine will be safe and effective for the majority of women, and it's important to keep the research going.
The biggest message I think that Jenny gave us is if you ever wanted to know what hope looked like Jenny. The coolest story she ever told us was, she's like, Leanne and Laura, she goes, I would wake up every day. I was planning my funeral. I was planning on what I would do with my kids. She goes, I had no hope. And then the trial came along and she said, I had hope. And she lived her life, the rest of her life, so differently. It was vacations with her mom and vacations with her husband and fun times with the kids. So you know what? We gave her hope, and that is exactly what hope looked like.
I couldn't agree more. Jenny was just such a warm person. I had the pleasure of meeting her and talking to her on the phone several times. And she was one of those people that even if you had never met her, the minute you started talking to her, she felt like an old friend. And you could see that hope in her eyes. It was a pleasure that she became part of our lives for the time that she was with us.
Back in 2023, we did an episode with her and everyone here. And I'll make sure that we put the link in our show notes, or you can go to remarkableresults.biz and search for CC111, Carmcast 111 from August of 2023. The reason we're doing this is to encourage you, our independent shop owners who listen to this. Number one, we want you in this. Number two, we want you to share this. Number three, 10 friends in your town that needs to get involved in this. It's breaksforbreast.com. Yeah, you got to do your own marketing because there's nothing on the side that allows you to, oh my God, they're going to send me this marketing package. No, because all the monies go to the Cleveland Clinic, so they don't carve out anything. So how hard is it? Go to the website, all these really cool things you download, get printed, put up signs. It's kind of a DIY community fundraising event at breaksforbreasts.com. Did I get that right, guys?
You're going to have a campaign in October, right? Everybody markets. Every month you're marketing. So why not do the campaign on this breast cancer vaccine research fund? We have the marketing toolkit. We have all the logos. If you want to do something yourself, you can download your logos. We have done for you marketing, and any of our marketers, our vendors that are on our website and all the marketing they share, they give a good rate, right? So that's their contribution. They charge as little as possible, and that's how they participate in Breaks for Breast. So you as the shop owner are going to get really good marketing at a really good price. And on our website, breaksforbreast.com, there's a little place that says participating shops. There's a button there, resource. Just click on that and everything will come up. All the marketing, the logos. We have press releases. You can just print out the press release and plug in all your shop information. We have a couple forms of that. We have Q&A. Any questions you have over the years, we've put together a sheet. So it's pretty
straightforward and simple.
Thank you. A lot of information on that.
Very intuitive.
We have information on how to get your vendors on board. If you are stuck and don't know how to ask your vendor, we have that. We have a sheet that you can actually hand your vendor so they know this is a legit thing, right? With all the information on the program. What am I missing, Leanne?
Gosh, you summed that up really well. We have tried as the years progressed, and this is year number 15. It's just, when Laura called and said, hey, we're on our 15th year, I'm like, wait, is that possible? I had to use my finger abacus to figure. I'm like, it is 15 years. That's crazy. But over those 15 years, we've had the opportunity that any time anybody calls us and says, hey, what about this? We've been able to add it to the resource center, or one of our vendors has been able to add it to their packet of great stuff to offer. So I think we've really got those bases covered to make it the simplest possible, fundraiser possible.
Let me talk about the elephant in the room. Oh, free brake pads for my customers in October for Breaks for Breasts. How do I do that? Well, Laura just mentioned we've got stuff in there, Q&As, that will help you understand how to speak to your vendors. the creativity that is going on in the industry to make this happen. And then 10% of the entire ticket, customers get free brakes. You send 10% into a fund, back up to Brakes for Breasts. It's easy. We've talked about this in past shows. Oh, okay, well, you can't help us out? No problem. We'll make you our second call this month. And so I'm not talking about strong arming anybody. I'm talking about we want the top tier shops in America that have great vendor relationships to pick up the phone right now and say, I'm getting on board with this program. This is amazing. Over $2 million in the last 15 years. I want in. You will help me get this done. And if you don't feel like you can do it just in the month of October, then do something every month. Take a percentage of every brake job that you have and just give 5%. Put it in a fund and then send it up.
Well, your message is spot on, Carm, spot on.
It doesn't just have to be in October either. We have a donation link on our website. And Justin, will you take money in November, December, March?
Sure. We need support every day of the year.
So yeah, that link is always active. So feel free to go to our website, click donate now.
Thank you for being here, everyone. Leanne Best, Laura Frank, both founders, automotive aftermarket professionals. You're talking to people that wear the same cloth that we all wear. And of course, Dr. Justin Johnson, head researcher at the clinic that's taken Dr. Tuohy's dream and continue to have your own passion for getting this vaccine through these phases. And thank God we learned a little bit about phase 1, phase 2, phase 3, and heard Jennifer's story. That's really been a driver. Any final word, Justin?
Yeah, just thank you to Leanne and Laura for founding this amazing, brilliant idea. I don't think it's ever been done in the industry before, right? This is something that's groundbreaking. And I think that's so fitting because what Dr. Tuohy did was groundbreaking. And to have all these minds come together for the same cause and have it be so successful, we really can't thank you enough. And thank you, Carm, for also giving us, this platform to talk about this program, and all the shop owners who are participating and all the people that are coming in and getting the brakes done and supporting these local businesses, because you're also supporting another small business, which is the Tuohy Lab. And, we couldn't have done it without you. We're going to wrap up the trial in September. As I mentioned, the preliminary results are very encouraging. Everything's looking great. We're looking ahead to phase 2 and phase 3. It's going to be 10 times as many patients. It's going to be multiple centers. And so we're going to need support. We're going to need it more than ever. And we're also, of course, working in the lab to make the vaccine better. We want to see a response in all women. We want to make sure it's as good as it can possibly be. So we have a lot of work to do. And we appreciate your continued support.
I have to make a comment on the Tuohy Lab, and that's something that I learned today. It's a small business inside of the Cleveland Clinic. And when you said the Tuohy Lab, I just can't help but think, I've been in it. When you think about it as a business inside the clinic, and there's a ton of them going on, all looking for donations and money and talent and phase 1, all that going on. I think it's something so important for us to learn how this stuff really works in the medical field. And so thank you for that realization for the Tuohy Lab.
I wanted to tag on to that, how important philanthropy was in research. I mean, it blew my mind when I learned about the key and how crucial it is for these labs to raise money on their own. The other thing is, Carm, you mentioned computer earlier, 15 feet tall, 10 feet wide. It's not like a PC that sits on our desk, right? The computer at the clinic.
It really looks like it's out of a science fiction movie, doesn't it?
Absolutely. The quantum computer. Yes. Amazing stuff.
You guys, shop owners, give your customers the opportunity to support this research. They may not even know about it. So by you getting on board in October, offering the brake pads, you're spreading the message to everybody in your community. And these people are going to be able to participate by getting their brakes serviced at your shop. So jump on board. Any questions, reach out to us. Our email, our phone numbers, they're on the website.
Get out there to your customers and tell them the story that you learned in this episode, the story that you have been learning about Breaks for Breast. Because when you tell a story about life, about situations, about need, about this particular fundraiser, who's going to say no? Hopefully we've told you the story so you get involved, and now you've got a story to tell your customers as to why you're doing this. Leanne, final words.
Why aren't more repair shops involved? Maybe it's a bit of a double-edged sword because Laura and I have absolutely kept 100% true to our word, 100%. Every single penny of that $2 million plus has gone directly to research. It funnels directly to the clinic. But on the flip side, that leaves us with that marketing budget of zero, which is why we rely on the independent repair shops out there to tell their neighbors and bring another shop on board. And it is truly incredible when you think about what we've done thus far. Independent repair shops, not a franchise, joining hands across the United States, into Canada, all to raise money for the same purpose, putting the brakes on breast cancer. With a limited budget, it's so much more important that all of you help us, and all we ask you to do is spread the word. Think of another repair shop out there. Ask them today, won't you join? Go to Breaks for Breast, look at what we're all about, and please bring one more.
Thank you so much. Continued success, everyone.
Thanks, Carm.
Thank you.
Thanks for having us.
Thank you, everybody.
Thanks for being on board to listen and learn from the premier automotive aftermarket podcast. Until next time.